pain profiling. So I think he's showing, yeah, fantastic. Thank you so much. We look forward to hearing about this. Oh, I think you're on mute. There we go.
Okay. Hi, everyone. My name is Kazuya Takahashi. I'm a research fellow from the Queen Mary University of London. Thank you for the opportunity today. Today, I'm going to talk about our new clinical study about chronic pain in patients with IBD. As you know, abdominal pain is a common symptom in IBD patients. When the disease is active, 70% of patients experience abdominal pain. And surprisingly, up to 50% of patients have persistent abdominal pain, even in remission. Besides, extra-intestinal symptoms such as arthralgia and fibromyalgia are also frequent in IBD. For example, arthralgia is one of the most common manifestations occurring in as many as 50% of patients. Furthermore, chronic abdominal pain is associated with depression and fatigue. All those symptoms can impair patients' quality of life. Abdominal pain in remission is not always associated with disease activity, and its mechanism is very complex. Brain-gut interaction, which means the mutual effect between the brain and gut, is suggested to be associated with abdominal pain. For example, altered immune function at the gut level, changes in the brain structure and function, and the effect of stress. Those factors are affecting each other and resulting in hypersensitivity of the gut system and altered threshold of pain. This change can finally lead to abdominal pain. To date, many studies have tried to find out the exact mechanism of abdominal pain. However, there have been some problems in the previous studies. For example, the sample size was small, extra-intestinal symptoms or psychological factors were not assessed enough, and the observation period was not enough, etc. So we still lack precise long-term data about the mechanism of chronic pain and its long-term outcomes. Therefore, long-term observation of psychophysiological risk factors tied to chronic pain is likely to have significant value to provide a better understanding and management of pain in IBD patients. So the aim of this study is to find psychophysiological and biological risk factors for the development of chronic pain by long-term observation of patients. These are examples of factors assessed in this study. This study consists of 3 parts. The main part of this study is to follow up 150 newly diagnosed patients for 18 months. We will collect the data using online questionnaires and recording heart rate using a smartphone app for this period. That means you don't have to attend our institution for this study, and you can join our study at home. Study 2 is a short version of Study 1. We will recruit 450 newly diagnosed patients, but questionnaires are less frequent and follow-up period is only 12 months. Last part of the study is just doing an online questionnaire once for patients who are already in IBD bioresource study. In all parts of the study, we will collaborate with IBD bioresource study. So new participants in our study will be also asked to join IBD bioresource. Biological data such as blood samples and stool samples will be collected by IBD bioresource, and we will utilize those biological data for the analysis of our study. As a result, we will collect a huge amount of data ranging from long-term clinical course to genetic data. The analysis of such big data is very complicated. However, we will use the cutting-edge AI analysis and try to elucidate risk factors of chronic pain. We will also use AI to make predicting model of abdominal pain and try to realize early intervention and personalized care for patients with IBD. which we believe can lead to better treatment outcomes. We are now aiming to start this study this year, since most part of the study can be done remotely. So I hope we can start this study within this year. Thank you for listening, and I'm happy to take questions.
That's fantastic. Thank you very much. It's very interesting. I'm going to launch your poll now. You've got 2 polls. Oh no, it's just the one actually. Sorry, just the one poll. I'll launch that now.
Okay. Yeah, in the poll, I'd like to ask if our study schedule is feasible for the participant. And I also want to know how many patients are actually having abdominal pain or other pain in the UK. Also, I'd like to know how many patients are satisfied with their pain treatment. Thank you. So while I'm waiting for the results, I will answer the questions, as many as possible. No questions at the moment, so I'm happy to take any questions.
They just arrived.
Oh.
Right at the bottom of the.
Okay.
Yeah.
First, are you also looking at different treatments for pain? It is very frustrating that there are so many pain medications that we cannot take because they can worsen a flare-up. Yeah, in this study, we just looked at the cause of pain, abdominal pain and other pain. But if we can find exact risk factors for the pain, we believe that will lead to the better treatment and better management of abdominal pain and other pain. And next, we will be looking at patients with indeterminate colitis. That is a good question. In this study, we will recruit patients with ulcerative colitis and Crohn's disease. So indeterminate colitis, yeah, we have to discuss with my team members. Thank you for pointing out. Next, do you have a hypothesis about the risk factors? Yeah, to date, several risk factors are reported to be associated with abdominal pain. For example, depression state or catastrophizing. Those mental risk factors are associated with abdominal pain and other pain. So I think those factors are really important, and we will investigate those factors using many questionnaires. We will precisely investigate those factors again. Next, how can I find out I'm registered for IBD resource? I have my data added. You know, we will collaborate with each hospital that is collaborating with IBD bioresource, and we will ask local research nurse to recruit participants in this study. So, and when it comes to newly diagnosed patients, we will also collaborate with local research nurse and consultant gastroenterologist, and thus we will recruit patients. And next one, I'm a long-term IBD patient with pain diagnosed after reaction to anesthetic. All studies for newly diagnosed patients. I'd be willing to participate to help me with less pain. Thank you. I think you are already diagnosed with IBD. So in that case, I hope you can participate in the third part of this study. And that is just answering online questionnaire once. Thank you. Next one. Will it be based on environment factors and time of day too? Yeah, we will also look into environmental factors, and we will do the questionnaires 10 times a day for 1 week. So we believe that will detect the effect of time and I believe we can detect the effect of daily activities on your symptoms. Okay, now let's look at the results of the poll. Is the protocol feasible for you? 90% said yes. Yeah, thank you. Thank you very much. This is very encouraging. So I think all parts of our study will be done online and remotely. So even under the current situation, I think you can join our study safely. And yeah, I'm glad that 90% of patients, I think it's feasible. And next, have you ever had tummy pain that lasts for more than 3 months? 64% said yes. Pain that lasts for more than 3 months is defined as chronic pain. So more than 60% of patients have experienced chronic abdominal pain. So I think that's a little bit higher than I expected. So I think our study, the results of our study, hopefully will find the risk factors and improve this number as many as possible. Do you have any pain anywhere other than in your tummy and that lasts for more than 3 months? 44% said yes. Yeah. This is also really important. To date, the study about extra-intestinal pain has not been paid enough attention. So in this study, we will investigate extra-intestinal pain as well as abdominal pain, and hopefully we can find the significant risk factors for extra-intestinal pain. Next, are you taking any medications for pain? 26% said yes. Okay, so that means 20% of patients have ongoing pain. So hopefully we can find risk factors for pain. Thank you. And are you satisfied with your pain treatment? 23% said yes, and 49% said no. Yeah, I think this is a very important answer. You know, one study showed 1/4 of patients were not satisfied with their pain treatment, but in reality, more patients are not satisfied with their treatment. So the importance of our study is to detect the exact risk factors, and thus we will improve management, and our result will result in better treatment for abdominal pain or other pain. So hopefully we can detect significant risk factors in this study. The last question is, has pain affected your quality of life? 84% said yes. Oh, that is very significant result. So yeah, hopefully our result will result in better management and better quality of life of patients. Okay, thank you for answering questions. And okay, I will answer the questions as many as possible. Okay, we need to be based on, I answered this. What is the aim to follow the heart rate? Do you find high correlation between heart rate and level of pain? Thank you for the question. The aim to record heart rate is to see the function of our autonomic nervous system. Autonomic nervous system is associated with pain. For example, autonomic nervous system has two main branches, parasympathetic nervous system and sympathetic nervous system. When the activity of parasympathetic nervous system is high, you will feel less pain. So it is important to see the state of autonomic nervous system. And now we can record heart rate using smartphone app. That is very easy to do. So in this study, we will see the heart rate to see the function of your autonomic nervous system. Next question. You said the problem with previous studies were too small. Is 600 a large enough sample to accurately measure those with IBD? Thank you. That is a good question. When it comes to study 1 and study 2, we will recruit 600 patients. But we will use very precise questionnaires, and we will record heart rate, and we will use precise biological data from IBD bioresource. So 600 may not sound big enough, but those patients will be fully phenotyped. So we believe that will be enough to find risk factors using AI analysis. And that will be enough to make a predictive model using AI. And also, in the third part of our study, we will administer questionnaires up to 25,000 patients. So, we can try, we can test our predicting model in those 25,000 patients, because we will use the same questionnaires in all parts of the study. The pain diagram say that psychological factors are causing pain, or that the physical pain of IBD causes psychological stress. Oh, that is a good question. So, as I mentioned, brain-gut interaction is associated with chronic pain in patients with IBD. That means stress and gut symptoms are affecting each other. So, of course, psychological factors can cause pain, and also pain can increase psychological stress. So they are affecting mutually. Next one. Are you looking into the relationship between IBD pain and menstrual pain at all? In this study, of course, we will ask participants about their period when we perform questionnaires. So I think we can distinguish, or we can see the relationship between the pain due to IBD and menstrual pain in this study. Thank you. Next one. how could we join your study? Okay, thank you. For study 1, we will mainly recruit patients from the hospitals in London. And for study 2, we will recruit patients who are in IBD bioresource inception study. That means we will recruit patients from more than 90 hospitals across the UK. But when it comes to study 3, we will approach patients who are already recruited in IBD bioresource. So if you are already in IBD bioresource, we may approach you once the study starts. And next one. Will you have equal participant with Crohn's and colitis? I have previously seen more research focused on those diagnosed with Crohn's. Thank you for your question. Yes, we will recruit both Crohn's and colitis. And after recruiting both patients, we will stratify those patients when we perform analysis. And so, thank you. And
okay, time for just one more question, I think.
Okay.
Thank you.
Okay. In the case of women, their monthly cycle can bring on Crohn's pain. Are you aware of this? Is this incorporated in the research? Thank you. Yes, that is an important point. As I said earlier, in the questionnaires, I will ask you about your period. So we will see the relationship between the pain due to IBD and the pain due to your cycle. So I think we can distinguish them, and we can see the relationship between them as well. Thank you.
Thank you very much. That was really interesting. It's really exciting to hear about how we might be able to develop better treatments in this area, because I know a lot of people just aren't happy with their pain medication at the moment. Okay, so thank you very much. That was fantastic.
Yeah, thank you.